Hi everyone, this is Dr. Mario Di Pascuale. Thank you for visiting us in our social media. Today we're going to discuss about everything about cataract and cataract surgery. Well, the first question that we have, what is a cataract? Cataracts is the pacification or cloudiness of our normal lens. The lens is a structure that is behind the iris and is in charge to focus our image from far, near, and intermediate. As we aging, these lenses tend to become more opaque or become more cloudy. What happened? All the image that coming from far or near is gonna be dispersed. Instead of focusing on one point, focus on multiple points. That is perceived as a patient, as a cloudiness, as a glare, especially in low light condition or halos. A patient also tend to say, I need to use more light in order to read or to do my normal daily activity. I've stopped going out. Why? Because I cannot drive anymore. I cannot see stuff anymore. The light or the headlight coming toward me, create a very dispersed environment that the patient can no longer see accurately, and therefore, they stop going out at night. So that's what a cataract is, and that's what the symptoms of cataracts are. What is the cause of cataract? What is the etiology of cataracts? Cataracts are caused mainly is because of aging of a natural process. Normally, when we're born, we can see clearly. All the image pass through to this beautiful crystal lens. What happens as we aging, the crystalline become more opacified. Other reason also that might happen, especially in Hispanic, is diabetes. When the sugar goes very high, induce opacification or changes in the natural composition of the cellular protein. What happens? The cells become from being clear to become more opacified. Other causes are related to medicine, like prednisone, especially in patients with asthma or patients with a chronic inflammatory disease, like rheumatoid arthritis or lupus or any other Crohn's disease that require chronic use of steroid. That induces a specific type of cataract that the deposit of the pacification occurring on the back of the lens. And sometimes there's a genetic cause too. It tends to maybe run in the family in the earliest stage. And of course, when the baby was born early, what we call congenital cataract. But most common cataract is that we see as aging cataract due to aging. Well, the best time to have surgery is when you have symptoms. Of course, there is some cataracts that, even anybody can diagnose, like typical hypermature white cataract that you can see because the imaging of the pupil, you cannot see anymore. You see a very imaging. But when the patient starts having symptoms like glare, halos at night, need for more light in low light condition, things like a cloudiness, or they don't like to go out anymore because they can see clear, because the headlight coming to them start bothering, creating halos or glare. This is the time you should have the cataract surgery and should be counseled by an ophthalmologist or an eye surgeon. Traditionally, cataract is used with one eye. In my particular personal view, I like to start with the eye who have the worst vision. And what we normally do is tend to do it 1 or 4 weeks later, we do the second one. Of course, we can do bilateral cataract, and especially I recommend for patients that are very far away. They definitely, they have to have another treatment in a very short period of time, or we can maybe follow up. So, but my personal recommendation is to do cataract 1 time a day, because we never know, even though the risk for cataracts are low, always the worst risk of intraocular surgery is a severe inflammation or severe infection, and that can happen in both eyes, and we want to prevent that. So for how long we need to recover, we can go back to our normal activities. Normally it takes about 2 to 4 weeks, ideally 4 weeks. However, you can do office work like they require no lifting, no bending over in a faster way. Do not rub your eye, even with or without surgery, and especially do not use any home remedy recommendation or any drops that your eye surgeon did not recommend to you. So you should pay attention to all these stages, especially for just operative instruction in order to avoid complication after the surgery. Probably yes. There is a different kind of intraocular lenses or material we have to use after cataract surgery. When we do cataract surgery, we replace your natural lens with artificial lens. And there's a different kind of artificial lens. The one included in your most of the insurance as the one we call monofocal. They are destined to correct your cataract. Therefore, what happens after cataract, you will require glasses to see and near. As a normal natural lens, the crystalline lens is in charge to focus imaging not only at distance but also allow you to read. As we aging and as well as the cataract start forming, the lens start become harder and opaque. And what happened? You lost that ability. This happened after the 40 years old, and we start noticing that we need, to distance our hands or arm in a longer way in order to read. As we remove the lens, as what happened in cataract surgery, you need to replace with artificial lens or prosthetic lens we call intraocular lens. The one is come with insurance is called monofocal lens, and that one definitely will require glasses for reading. However, if you were informed and you decide with your surgeon that you want to a lens they call multifocal lens or lenses that allow to see intermediate distance with ED of lens extend that of focus lens, you might require way less because those are we call presbyopic lens, but those are more high premium lenses that require an extra cost from your part, or even the most advanced technology like a adjustable lens that you can do monovision or mini monovision, or even the new lenses we call the light adjustable plus lens, which we're gonna have fully available here in El Paso. If you have further questions, please do not hesitate to talk to your surgeon, or you can make an appointment with us to answer all these questions that you may have. Most of the insurance should be cover cataract surgery. Cataract surgery entails, the facility, which is you're gonna have a facility fee, you're gonna have a surgeon fee, and also you're gonna have maybe an anesthesiology fee. Therefore, so you should know what is your benefit. When we're talking about your benefit, we're talking about deductible and copayment. That's a part of your responsibility as a patient. And you should know that with whoever, with the beneficiary of your insurance, you can call your insurance and facility, or also you can call our billing department, and we're happy to show you what do your insurance cover, what you insure, and what is your responsibility. Most of the time, I will say, that part should be covered. However, there is a service like how we do the cataract. We also offer, we do femtosecond laser cataract surgery. That part is not covered. Same as the type of lenses like premium lenses, like multifocal lenses, EDOF, extended depth of focus lenses that are focused more in presbyopia, toric lenses that are more focused on astigmatism management, and the latest or the best, one of the best lenses we call light adjustable lenses. Lenses can be adjusted after that. With those called premium lenses, those lenses as well as the femto laser cataract surgery is not covered because it's considered as a refractive procedure, because it's a condition that you were born with, and you is part of your responsibility. Thank you so much for holding all during this time to learn more about cataract and cataract surgery. Please, if you have any question, if you really want to see us, follow links that are down below. Call us to make an appointment with us. Therefore, we can answer any of your questions, or we can book your surgery and discuss that time with us. If you have further questions, please don't hesitate to contact. Thank you so much for following. This is Dr. Mario Di Pascuale and LASIK Cornea and Cataract Specialty Center.